Hello, everyone, and welcome to today's webcast. We're going to be talking today about note form reporting and unlocking the value of your V11 data. Before we start, I just wanted to mention that your phones have been automatically muted, but if you have a question, please feel free to ask it on the Q&A panel in the WebEx. We'll have some time for some Q&A at the end, so I'll make sure I get to those questions. So as for an introduction, my name is Fallon Hartford. I'm a managing technical consultant here at Galen. I've been at Galen for about 3 years now, and since I've worked here, I've worked on a variety of data conversions as well as custom reporting requests from Allscripts clients and from some other vendors as well. I've also worked on quality initiative reporting objectives, like some that we're going to talk about today that utilize note form reporting. And I've also worked very closely with this product pretty much since the beginning of my time at Galen. So I'm pretty excited today to show you some of the cool stuff that we've done with our clients utilizing this product. During the webcast today, we're going to talk about the current challenges of reporting on Allscripts V11 notes. We'll go through an overview of what note form reporting is, how it works, and some of the resources that it needs to utilize. And then we'll go over some use cases of how our current note form reporting clients are utilizing it, both for workflow automation and for quality incentive reporting or other internal incentives that they might have. And then finally, we'll end at the end with some time for some questions and answers. So I want to start today with telling you what note form reporting is not, because I think that's probably pretty important to get that off the table. First of all, it's not a solution to replace anything that you might already have in place, such as Allscripts Analytics, if you've got that, and especially meaningful use reports. It's really more of a supplemental tool. We'll go into a little bit more of that as the webcast goes on. But what note form reporting is, however, is basically it's a tool to aggregate your V11 note data discretely into a centralized location. It's going to allow you to more efficiently and accurately capture information for quality incentive and shared savings programs, for fee for performance, Medicare Advantage, MSSP, and PCMH, just as a few examples. It also provides data to allow for automating and streamlining workflows, including automating charge capture, which we'll go over in a bit. Currently, because of how the V11 notes are stored in the Works database, there's really no easy way to be able to discretely report on your note data. And so I'll show you an example of how your data is stored currently today without note form reporting, just to give you some reference probably in a few slides. So this is an example of a smoking cessation note form. Some of you may be familiar if you are one of the note build experts or work pretty closely with providers that enter in notes. You can see that all the items that they've got to choose from here are all items that providers can fill out when assessing for smoking cessation and for documenting it in the note. So some of you that have Allscripts Analytics may know that some of the items on this form are tied to medicine findings, which are able to be pulled out discretely if you have Allscripts Analytics. You can see here everything on the green form that's highlighted here are tied to medicine findings. So if you did have Allscripts Analytics, you would be able to discretely report on the information that's highlighted in green. But you can see there's a lot of information that's not highlighted in green. So here I've highlighted it in red. And you can see these forms are custom terms. So they're either not linked to a medicine or perhaps if you've got a custom form, you've created the controls that are tied more likely to what you want for your organization rather than to a, some sort of control that everyone is using. So you can see here, there's some valuable information that are sort of being taken off the table, and your providers are taking time to enter this information into the note, but there's really nothing that you can do with it in any capacity other than just having it documented for billing purposes or for viewing the notes manually. But with note form reporting, all of the data that's captured, whether it's tied to a medicine term or a custom term, whether it's a checkbox or a radio button, one of those yes/no buttons, or if it's got free text associated with it, we can get that information using note form reporting, and it's all able to be discreetly extracted and used for reporting for any number of initiatives within your organization. So like I had mentioned, this is a sample note from one of our test systems. It shows the XML format that the notes are currently stored in the document table of the works database in Allscripts. You can see here why it's pretty nearly impossible to report discreetly on the data in the notes. But if you look closely, there are tags within the XML that organizes the controls in the notes so that they're sort of individually coded. And the fact that the V11 notes are stored in this way makes it so that it's a semi-structured format. It makes it so we can parse out the controls and store it in a separate SQL database. If you were to want to run a report and try and view something that was in this note without note form reporting, you'd need to decompress this field in the works database. You'd need to run a string search to get any keywords such as we saw smoking cessation performed or any of those keywords in there. And then any of you that are familiar with the document table, you know how hefty that table is, and running a search on that is pretty resource intensive, so something that should proceed with caution. So this slide shows an illustration of how the note form reporting process works. When providers, they go in and they add, they can modify, or they can enter an error any of the version 11 notes. Note form reporting on a nightly basis retrieves those notes and pulls the XML of the notes over to a separate server that utilizes a Windows service, and that parses out all of the information from those XML tags that we saw earlier and puts it into a SQL Server database. So note form reporting utilizes standard technologies. Most of you probably have these on some of your database servers, like SQL Server integration, Microsoft.NET, Windows Service. Note form reporting needs a server to live on, but it doesn't necessarily need its own server. We've had some clients that will put it on an existing analytics server, or if they've got some sort of reporting server, they will install it on that, or even we've had some that it's just been easy enough for them to create a new server just for note form reporting. And if you have just something interesting to note, so, you know, we're going back to the works database and we're grabbing that information that was entered by the providers. If you're utilizing a disaster recovery or some sort of copy of production, we can actually use that to grab the note so we're not hitting production. But if you're not, the nightly hit that we pull from production is really quite minimal. So, and we can schedule that according to whatever the needs of your organization are. So I just wanted to include a list of, just to have this down. These are sort of the specifications that we have. This is, if you've got Allscripts Analytics, it probably looks pretty familiar, same type of server, and something that can be put on a server with something else. So now I want to get into some examples of how some of our clients are utilizing note form reporting, and specifically here I'm going to talk about charge automation. So this, what we're looking at, is an example of a care of older adult note form that tracks a required CMS star HEDIS measure. So this is a way that we can use note form reporting to automatically add appropriate charges to encounter forms in the EHR. It's a pretty cool process that we set up for one of our clients, and there's a lot of different ways that you can use it. So I'll go over some of those. This is just one example. One of the advantages to doing it this way, by doing it automatically through the note, is that the necessary documentation is already getting recorded by your providers for billing purposes. They're recording that they're doing this assessment, any of the procedures that they're performing, they're documenting that in the note. So this process is taking information that's already being documented, and it's getting those CPT codes that you can see in the note are being specifically coded for the different procedures that are required, and it's able to grab that information and submit the charge so that it gets posted on the encounter, just as if someone was manually posting that encounter. But this obviously has its advantages because staff don't have to go through the note and try and pick out the charges. They don't need to manually issue them, and so it really takes out any sort of human error that might potentially come with manually submitting charges like this. So this is an example of what a cardiology practice that we did worked with us for implementing a custom note form to capture procedures that were performed and simultaneously dropping the charge to the encounter. This type of automation that I'm going to show here is for a CPT-4 code, so for medical procedures and physician services. So you can see here there's the echo note form, and the CPT codes have been automatically, or they've been added to the control name like we saw in the CCM form as well. So when the providers click on a button to indicate that they want to, let's say, order this transthoracic echo for the patient, the charge will then automatically get dropped to the encounter form. So you can see there the CPT code. We can see the RVU that's associated, what the charge specifically was, and we can also see the link diagnosis. So we've linked it back to those ICD-9 and ICD-10 codes that are associated with the encounter that this charge, that this note form was created, and that this simultaneously that this procedure was ordered for. I do want to note quickly, though, that for this worked for this specific workflow. It might not necessarily work for every workflow. For this practice, the person that was ordering the echo was performing the echo right there, and therefore was also billing for it. So it sort of saved them some steps because the same person was doing that. But if, for instance, you were going to be ordering and something was going to be performed at a different location or sometime in the future, this workflow obviously wouldn't work. But if you had something like this where the one person was going to be simultaneously performing and ordering, then something like this would work. But it just gives you a great idea to see how something can go from the note form to the encounter form. So while we're on the topic of charge automation, I also wanted to show you another pretty interesting thing that we're doing with a client to automate charges for BMI codes. So in Allscripts, probably a lot of you know that when a height and weight are taken, the BMI is automatically calculated based on those values, and this is something that gets measured as part of a meaningful use measure. So depending on what the BMI falls under, it gets assigned a V code. So what we're doing is taking that V code and being able to look up the appropriate ICD-9 code based on what that BMI range is. And one thing that's kind of important to note about this is it's pretty rare to accurately see the right ICD-9 code, but it's pretty important for especially those organizations if you're involved in a risk-based contract, because financial incentives for those contracts are tied to assuming risk for your higher risk patients. So each patient is given a Medicare risk score, and keeping the high-risk patients healthy and out of that hospital equates to higher financial incentives. So a solution like this is really going to help to make sure that you're representing your patient population as accurately as possible. It will help you get the most out of those incentive dollars. We've also, at Galen, we have a few other systems that can help with things like risk-based contracts. We've got things like Pinpoint Care. So if you're interested in, if you're about to be involved in a risk-based contract, definitely reach out to us. We'd be happy to talk to you about that. So here's an example of charge automation for non-billable charges. So something like this, non-billable charges, they're important because they're tied to pay performance and also for year-end bonuses. So you can imagine that making sure that the appropriate billing code is assigned to a charge that's for some sort of fee is hard enough, but making sure that the appropriate billing code for something that's non-billable is going to be a little bit harder. So it's also, it's something that's very challenging, but that we worked with a client to try and take that challenge away from and make sure that their providers that are doing these assessments that are tied with HEDIS scores are actually getting the incentives and the year-end bonuses that they deserve for that. So kind of going back to that older care of adults form that we saw earlier, You can see in the spreadsheet up above this form how there are different indicators that are assessed and can be tied to different CPT category codes. So in this form, clicking on, in the note, on any of the checkboxes that are related to the advanced care planning, for instance, will assign that, assign that CPT 2 category code of either 1157 or 1158 to show that advanced care planning was performed for this visit. And you can see for functional assessment, anything within here is associated with a 1170 code. We've got the pain screening, and then finally the medication review. And so clicking on any of these will associate this form and that during this encounter, these were assessed. So you can see here on this encounter form how these codes got dropped to the encounter charge and how they're linked, like we saw before, to the appropriate diagnosis code for both the first and second ICD-9 code. And then if you also look at the RVU there, these are all 0.00, so they're all associated with non-billable charges. But still, like we've seen, since they're tied to pay per performance, still very valuable information. So by dropping the non-billable charge on the patient encounter, we have now put the data in a place where not only are we documenting it for the patient, for the provider, because it's tied to their incentives, we're dropping the charge to send to the insurance company. We know that it's accurate because it's based on what the provider has chosen rather than what somebody has gone back in and chose to code that as. And we're also putting it in a format now so that you can run reports and you can see for my patients, for my providers, which of these CPT codes have been assessed for certain patients. Do we need to go back, make an appointment? Do we need to do any of these assessments to make sure that our providers are doing what they can and getting the most out of their incentive dollars? So this form, now that I'm showing you, is a form to show you how it's possible to appropriately capture when certain procedures are done elsewhere, not at your institution. So for Medicare Advantage, you need to report that an influenza vaccine was given. And if you're the provider and you're giving the immunization, that's obviously very easy. You can just document that they needed the immunization, you gave it, and it's done. But if the vaccine was given elsewhere, which we see a lot, especially for influenza, it can be done at a CVS, at a Minute Clinic, but you still need to record, though, that vaccine was given elsewhere. And there's actually a CPT code there, 4274F, that's associated with the vaccine given elsewhere. So here, if the provider clicks that, they can choose, they can pre-type in where that vaccine was given, and that will drop that charge on the encounter to show that they actually were given the vaccine, just not at the institution. And this is also, there's a similar situation here for patients that have received an eye screening for diabetic retinal disease. So this includes people who have either had the eye exam by an eye care professional, not necessarily them, but just an eye care professional in the past year, or they need to show that it was a negative eye exam within the past, the prior year to the measurement year. So you can see clicking on each of those scenarios associates with a different CPT code. So we're taking out any of the sort of manual work for this. This is being documented anyway by the providers. We're able to drop those charges. So not only are we automating the charges, but we're making it so that we can pretty accurately report on this information as well. So this is an example of a post-discharge form that one of our clients is using and utilizing note form reporting for. So in this type of example, this is kind of cool. They're utilizing a couple of technologies where they've got an ADT feed from the hospital letting them know when a patient has been discharged. And so they know when they need to follow up with the patient for their post-discharge care. So the measure here that they're assessing is going to measure the percentage of discharges for the measurement year for age 65 and older, and making sure that post-discharge, those patients' medications were reconciled within 30 days of discharge. So the medical record has to document that you reconciled those medications. So they're documenting that in the chart. It doesn't necessarily require an outpatient visit, just documentation in an outpatient chart. So providers can call the patient, reconcile the medications, document it in the note, and then it will drop that charge or the CPT code for the 1111F for the medication reconciliation and drop it to the encounter form. And they can get credit for having reconciled medications within 30 days of discharge. I want to talk a little bit about chronic care management now, because I think this is actually a pretty cool way in which one of our clients is utilizing note form reporting. There's a new initiative through Medicare chronic care management, and it's to have a non-face-to-face interaction with your chronic care patients over the phone. And so the initiative is that every month you can receive $42 a month per patient if you spend 20 minutes on the phone with that patient that's under chronic care, and it needs to be documented that you're spending 20 minutes with that patient. So there are some third-party softwares that can track this, but if you're already using note form reporting, you can see it's pretty easy to utilize this into one of your note forms and one of the reports that you received from note form reporting. Our client, for instance, he had kind of assessed some other vendors and realized that, you know, he didn't really want to be purchasing another type of software to do something like this. He could utilize something he already had. So using note form reporting, our client created a note form for chronic care management because you do need to document in the note for these patients what you've discussed. You can see there we've got the description of the task and the exact amount of time you spend with each patient. So at the end of the month, our client, he can run a report, he can see the total time, he can add up how much time has been spent with a patient over the phone. And sometimes he'll see people that maybe, 17 minutes has been spent total that month with that patient. And so, it's the end of the month and they've realized that it's worth it to just have a quick phone call, check up on the patient, see how they're doing. And if they can equal 20 minutes, they get $42 for that patient that they're able to collect. So although this process is a little bit more manual, you have to put in how many minutes you spend. You have to kind of type in what you've discussed with the patient. It does give you a report that you can run on to check your progress, and it also gives you a report that you can give to Medicare. Because right now, CMS doesn't have any formal reporting system for this. That could change, but for right now, we're giving you the opportunity to be able to track that, to perform actions on it, and giving you a report that you can show to Medicare to help prove that you've been spending time with these patients. One thing I want to talk a little bit about is PCMH. We have clients that have utilized note form reporting to apply to become a patient-centered medical home and also to keep up with their certification after the fact. Patient-centered medical home, this is mostly about meeting goals. So we've seen so far there's actions that you do. You assess patients for things. You order, you place orders for different procedures. But with PCMH, it's about goals. It's about keeping people healthy and just, spending time with those patients and assessing them for things, for a variety of different things. You can see here, I'm showing this comprehensive diabetic care form. And one thing I just want to make sure that I point out is that there are, for each type of goal associated with PCMH, all of these goals can be and should be for, for billing purposes being documented in the note. But there's no other place that most of these goals can be documented, so except for within the note forms. So utilizing note form reporting, it's easy for you when you're going to apply or when you're keeping up with your certification for PCMH, you have a way that you can run reports and say, you know, here's my patients, here's the ones that are diabetic. Yes, we've assessed for their goals. Yes, we've recorded what some of their barriers to goals are. We're keeping track with what their targets for their A1Cs are. So this is just one example of a form for PCMH. I'll show you a few other ones because we have one client actually that's utilizing over 100 note forms, and we've worked with them and we've created a process so that on a nightly basis we go in, we look at all of the notes for their patient population that have been filled out that are related to PCMH forms, and we pull them into a separate database. So we're sort of creating a little mini data warehouse just for PCMH for them. And they run reports, and they've done some cool things like putting them into alerts in the patient banner so that if a patient's being seen and they realize that they haven't assessed them for one of their goals, they can make sure that they do that so that they'll fulfill their requirements. Makes it very easy for their providers to see what they've done and what needs to be done. So here's another example of a PCMH measure for goals and progress towards goals for hyperlipidemia follow-up. Again, like I mentioned before, most of this information is really only documented in the note. It's hard to place, you know, there's not things that you can really be placing orders for when you're talking more about goals and progress. So it's more important that you're able to capture it in the note where you would be capturing it anyway, and then you ensure that you're meeting the measures for this. Here's an example of a custom PHQ-9 form that a client set up to assist with their PCMH reporting. So in the upper left-hand corner, you can see that there's a checkbox that shows that a depression assessment is performed. I'm sure at some of your organizations, you know, depression assessment is something that we hear of all the time that's tied to different incentives, making sure that they're performed, not only just making sure that they're performed, but what the score is. So you can see in the lower right-hand corner, we've got a box where they can fill in what was the total number of points, and then everywhere in the middle, we can see for each of the different measures, what did they choose. So for measure 1, was it not at all? And you can see for each of the individual measures and then the total points. So there's a lot of information that you can get, not just was it performed, but you can get to what did the patient actually enter. We just saw one of the custom PHQ-9 forms, but I also wanted to point out that Allscripts has a delivered PHQ-9 form. So if you didn't want to do a custom form, you know, if you're wondering, you know, could we still be able to report on our data using note form reporting, even if we're using an Allscripts delivered form? Yes, absolutely. We just had a client that chose to use their own custom form. I think they just wanted it organized in a way that worked more for them and for their goals. But if you were using a delivered Allscripts form, we parse that, we parse everything. So I also wanted to point out that we do have a few clients that are utilizing note form reporting that are using the data that gets parsed into their note form reporting database to incorporate into sort of the bigger picture into like a data warehouse. So Galen actually has a custom warehouse solution that we've developed that utilizes pulling data from multiple sources, including the practice management database, any of your outpatient. We've worked, doesn't even matter if you're using Allscripts for some, Epic for some, Athena for some. It can even actually take in inpatient data, and it normalizes that data into one location to make it so that you can report not just, you know, in silos for your different systems, but just on a whole. So using note form reporting, you could take that data that you're entering in as a note, it's going to be discretely in a SQL database, and therefore it can get incorporated into a SQL Server data warehouse that you've got that has data from any of the other systems that you're utilizing in your organization. So one of the examples, I think one of the big ones, we had just seen depression screening before, but our programmers are working with some of our clients and they're making sure that the depression screening data that's being entered into the notes is getting utilized into their data warehouse so that when they're reporting for their quality initiative incentives and also for any of their internal measures, just making sure that, this is being performed, is able to get incorporated in with the rest of their data. So we went over a few things today. This first part is sort of a summary on what is note form reporting. So note form reporting, it takes the semi-structured, non-discrete visit note data that's stored in sort of a chunk or a blob of text in the document table, and it parses it out into discrete data so that you can see exactly what was entered, and you can actually be able to run reports in SQL like you would if you're running data from the Works database. Note form reporting gives you the ability to report on any data from the V11 note forms, whether they're medicine or custom terms, whether they're all scripts delivered forms or custom forms that you've created. And the platform for putting it into discrete data in a SQL database makes it easy to run reports, and it gives us really a great platform for being able to use it for some of the more advanced case uses, like we've gone over today, how some of our clients are using it for PCMH, a lot of Medicare Advantage we've seen that are tied to real dollars, the MSSP and the HEDIS scores, dropping those charges we've seen for dropping those non-billable charges to the encounter to be able to more accurately measure HEDIS scores, and then just some other quality incentive reportings, and then really just taking it a step further and doing charge automation, whether it's non-billable or if it's a billable type of charge. So some of the important takeaways from that is taking the information that's already being entered by providers and being able to run metrics on that, so reporting on that, or being able to drop it into the charge. So you're taking out all that manual work and making it so, at the end of the month, if you're trying to report for some of your quality initiatives, you're not going to be scrambling at the last second to be reviewing notes, to be seeing what was charged or what was assessed or performed. You've got sort of a warehouse of all of that information right in front of you, and all you need to do is query for it. So I wanted to just post this slide, and a copy of these slides is going to be available on our wiki page. So I know that's a question that people usually have, if they can get a copy of it to review. So these are some of the useful links. We've got a wiki page that's continuously being updated, so you can check that out. There's some tips and tricks for all scripts, as well as some other, there's also a Meditech wiki as well that we've got. For our webcast calendar, if there's any future webcasts that you're interested in attending, just take a look at that calendar. All of them are up to date on the calendar. And then our blog, actually this past week there was a success story about one of our, I think what we've done with a client for PCMH reporting, utilizing note form reporting, was posted earlier this week. So you should go and check that out, and you can get some more information on note form reporting from there as well. Okay, so with that overview, I just wanted to take some time for a few questions. So the first question that we got is, if we were purchasing note form reporting today, would we be able to see any data that was entered historically? So this is actually a really great question, and something I should have covered, but we go back, so not only do we, on a nightly basis, we check all of the information that's been updated, but we do go back and historically get all of your V11 note data. So we'll be able to go back to the beginning of your implementation of V11 note grab that information, and then you'll have all of that available in the data warehouse or in your note form reporting database. What about the V10 notes? What happens with those? So for V10 notes, I think most people are on V11 notes now, but for V10 notes, these are in an unstructured format. So the XML format that we're using to actually parse it out isn't present for V10 notes, so it's not something that we're going to be able to parse. So unfortunately, just because of the way that V10 notes are stored, we're not going to be able to get any of that information. But from the beginning of time, from you using V11 notes, we'll be able to get that. Let's see. Will this format work for all the future versions of notes? So this is another good question. As far as we know, the future of Allscripts notes are going to be stored in an XML format. So this is going to continue to be supported. As soon as we find out if there's any change, otherwise we'd obviously have to, you know, look into that and see if that's something that we'll be able to support. But for the near future, at least, these notes are going to stay in this XML format, so we will be able to continue to use note form reporting. Is this solution a real-time solution? So the data gets, so every time something is updated, the note is updated, or the note, there's a new note that's created, it goes in, so it goes in that day, and then on a nightly basis is when we go in and we grab that and we parse it out. So basically your note form reporting database is going to be up to date with yesterday's data. So we've seen, like, for the charge automation, if you've ordered something or you've performed something today, those charges will get dropped tomorrow. And another question, we use a lot of subforms. Can you report data off of subforms? And yes, we actually can. That client that I showed you that we're reporting with for PCMH, they actually utilize a lot of subforms as part of that. So yeah, we can definitely report off of subform data. It's really, you know, just to reiterate, anything that is anything that's entered into the note is something that we can parse out. Let me check. I think there might have been another few questions that were asked. There are some that if I have to follow up, I don't want to answer anything incorrectly on this. So I have a record of everyone that asked a question, and I can reach out to you individually to answer those questions for you just to make sure I have all the right information. So if you've got a question, make sure you enter it. I'll make sure you get the answer. And like I had mentioned, we're posting this, the slide deck for this on our wiki, where we'll also have the answers to all of the questions that I went over, as well as any questions that I found answers for that you might have asked that I didn't get to. And if you're interested in talking to us more about this, definitely feel free to contact us. I'm very happy to talk to any. We do demos that basically cover what I covered today, but if you've got more specific examples or you've got incentives that you would like to talk through with us, we're definitely always helpful to talk through with you and give you some more examples than I gave you on the phone today. So with that, if there's some more questions, I think that concludes the webcast. Thank you, everyone. Have a great afternoon.